Hello, everyone, and thank you for visiting with me today. My name is Deontay Marquis. I'm a registered nurse practitioner in Southern California. But today, as you have already noticed and are already aware, I will be hosting your 2 hour review course for your Florida class that you're taking today, where we will be reviewing how to properly self administer or assist in self administration of medications to residents. This will be a several part review course that we will be doing today, and I will be hosting each of those parts with you. So without much further ado, let's begin today. And I have the handbook here. We're going to review from starting on page 17, chapter 2. Now, the topic of chapter 2 is medication administration and safety. So, of course, that is a very broad topic. So, we're going to narrow it down a little bit and specifically focused on the routes of administration and what routes are appropriate for each individual that will be administering medications in the healthcare team. So, routes of administration that are allowed by trained, unlicensed professionals. So that means you have received training on how to perform these tasks, as you see here, but you are unlicensed. So you are not a registered nurse. You are not an LVN, okay? You are a part of the healthcare team. And if the patient needs your assistance while they are administering these medications to themselves, you are allowed to help. So, of course, the most common that we'll see is orally or by mouth. So, if the patient is taking a pill or some type of liquid. Sublingual, that means that the patient is supposed to be placing the medication underneath their tongue for a certain amount of time until that medication dissolves and is taken into the bloodstream. Ophthalmic, so we all take eye drops. That's a fancy word for into the eye. Otic is into the ear. Sometimes patients have inner ear infections and they need some assistance administering their ear drops. So you are allowed to do that if you are trained, unlicensed professional. An inhalant. So think of patients who need an inhaler or maybe some type of breathing treatment that they can set up themselves but need some assistance. Uh, Topical. So topical, that's any type of skin ointment, cream that we're applying to the skin, or transdermal. So while we're talking about administering medications to the skin topically, medications can also be administered transdermally. So that's some medications as a patch that's applied to a certain area of the skin, most commonly a pain patch, and it's applied to the skin in that area and removed at a certain time. And maybe the patient needs some assistance applying that patch to a particular area. The trained, unlicensed person can assist them. Now, those are, again, the routes of administration that if you have received the proper training, but you are unlicensed, you can assist. And I put emphasis on assist the patient with administering this medication to themselves. But other medications may also be needed, which you cannot assist the patient with. These medications can only be provided or assist the resident with taking these medications in a particular fashion by nurses or medical professionals who have a license. And those routes, as you can see, will be rectally, vaginally, subcutaneous. So subcutaneous means anytime medication is going underneath the skin. The most common way that we administer medications underneath the skin is with a needle. So for instance, if a patient needs insulin and they have a needle and it needs to be injected into their arm, you need a nurse or a licensed professional to assist them only. If you are unlicensed, you cannot assist them. Intramuscular, that is another form of under the skin, but actually the medication is going into the muscle. So quite often, these patients may need to give injections to themselves intramuscularly. And that is something only a nurse or a licensed professional can assist the patient with. Intravenous, that's when medication is injected directly into the vein. You want to make sure that a nurse or a licensed professional is present if the patient tells you that they need assistance with this type of medication, any of these medications, because of the skill that is necessary for them to be administered. And last but not least, as you see there, nasogastric, so into the NG tube. Now, you may or may not know what an NG tube is. An NG tube stands for nasogastric, and that's a tube that goes into the nose, through the nostril, left or right, and it is passed through the throat, so in the nose, down the throat, into the gastric area or the stomach. So please pay attention, make note of this, of what you are allowed to assist the patient with. And even if the patient just needs the smallest amount of assistance with something that is listed down here that you do not have a license to assist them for, do not assist them. Please get a nurse or licensed professional to assist them. Unlicensed staff may not administer medications. They are only allowed to assist. I'm trying to reinforce this to you again. You are allowed to assist with self-administration of a medication, but you are not allowed to administer the medication, even if the medication is oral, sublingual, ophthalmic, or anywhere on this list. If you do not have a license, you are not allowed to administer any of these medications, only assist. Okay, so facilities that provide medication administration must have available a staff member who is licensed to administer the medication according to the doctor's order or as the medication is prescribed on the label. And why is this important? This is important because for many reasons, but one of the most important reasons is that these medications can cause serious reactions that can affect the patient's health instantly from the moment they receive the medication. Some may be a more delayed response, but nonetheless, the patient is at the forefront of the focus of the healthcare team, and we want to make sure that the appropriate staff is always available to administer these medications or provide assistance for medications that need a licensed professional. And medication administration is forbidden for any reason by unlicensed personnel in Florida. Okay, safety. Yes, medication safety. We want to make sure that when we assist residents with self-administration, especially if they're taking multiple medications, that we give them the time and attention to detail that is required to ensure that the task is carried out appropriately, and most importantly, to keep them safe. Again, licensed staff only. Medication administration, licensed staff only, okay? This is a huge concern in hospitals and nursing homes, assisted living facilities, wherever you work. If you are in a medical field, this is a huge concern, medication safety. As I'm sure you are aware, there are thousands of deaths every year due to unsafe medication administration. So it's very important when you are assisting these patients with self-administration that you talk to them to get an understanding, to make sure that they are administering an appropriate medication. While you can't administer the medication to them, we can assist them in making the appropriate decision. Or if we notice that something is not right, we can take that information to the appropriate personnel, okay? Now, persons under contract to the facility, so this is staff or volunteers who are licensed. So nurses may administer medications to residents. They can also manage the weekly pill organization for residents who have been approved to self-administer medications themselves, document those observations, and report to the doctor or physician what was observed. So safety, again, is number one importance when we are dealing with medications for patients. It is very easy to make a mistake with medications. So how can we make sure that you don't make an error? when you're administering a medication or assisting a patient with self-administration. You want to specifically make note to eye and ear medications. Now, why is that? Well, because they are quite commonly packaged in similar packaging. So they both have to have a dropper. And medications that are made for the ear chemically are made differently than medications that are made for the eye. Even sometimes if it may be the same medication, for instance, I've had patients that take, one patient takes an antibiotic that's approved to be given for the ear only, and that same antibiotic is also prescribed for another patient, but that patient may be taking it for another reason because they have an eye infection. And if you were to switch their medications and administer the eye medication into the patient's ear and the ear medication into the other patient's eye, even though it's the same antibiotic, we would have some significantly varied responses from those patients, and we would also have some high risk involved. So please pay attention to ear and eye medications. Make sure that they're going in the right place. Yes, I know it sounds silly and obvious, but I want to bring it to your attention so that when you are in the middle of your work day and it's very busy and you have several patients who need your assistance, that whenever you pick up an eye medication or an ear medication, you pay special note to those medications. Now, the original 5 rights of medication administration to make sure that we're giving the appropriate medication and we aren't running the risk for medication errors, we want to pay attention to 5 things that patients have the right to. This is their given right as our patient, and that's always right resident. Make sure they're getting the right medication, and make sure that that resident getting the medication, that it's the right dose at the right time, and it's being administered the right route. Now, when I was in nursing school, we were taught the 5 rights. We were able to recite the 5 rights, but as time went on, of course, they've added on to those rights. So it's actually 9 rights of medication administration now. So in addition to right resident, right medication, right dosage, right time, and right route, there's also right documentation. The patient has the right to refuse. The medication should be given for the right reason, and which we should be noting the right response after we have administered that medication to the patient. And here you'll see in full the 9 rights of medication administration in assisted living facilities. Okay, so again, the right resident. How do we make sure it's the right resident? Each facility has a different policy on how to properly identify a resident before administering medications or assisting with self-administration of medications. But you want to make sure you know the resident. Identify them every time you interact with them, especially if you're giving them a medication. You want to have them confirm their name, their date of birth, and check their picture with permission, or any other means that are available to accurately identify at least 2 separate identifiers. So you can ask the patient to identify their name and their date of birth, and compare that information to whatever you have on file to ensure that you are, in fact, administering or assisting with the administration of the correct patient. So we have the right resident. Now the right medication. You want to check the medication label and the order for that medication 3 times. No more, no less, 3 times. You want to check the label, read the label to the patient, and verify that the resident understands the drug dosage and the reason, if known. And this will do 2 things. This will allow you an opportunity to educate the patient. And also, many times, these patients have been taking the same medication for years. So if you read a label to them and it's something that they don't know or they don't recognize, that should give you a clue that something might be right. Let me check this for a second and a third time. because these residents, many times they know these medications just as well as we do, okay? So we have the right resident, we have the right medication, we've verified who the patient is, and we've also verified with them the medication that they're receiving. And in doing so, we also check the right doses being administered. We want to make sure that this dose is being administered at least, again, 3 times, no less, no more. Triple check the label, the medication ordered record. So we have the right dose, right medication, right patient. We want to make sure we're giving this medication at the right time, at the time it is being prescribed. If it's prescribed for morning, we want to make sure we're giving it in the morning at a set time. If it's being prescribed at night, before bed, before dinner, we want to make sure that we are following the instructions as listed by the doctor on the medication bottle appropriately, okay? So, let's see, do we check the time? And just remember that you cannot administer the medication more than 1 hour before or more than 1 hour after the time for which that medication was ordered. Best practice is to administer the medication at the exact time that it is indicated on the label or in the order. So if it says 8 o'clock, we want to give it at 8 o'clock. We don't want to give it at 7, we don't want to give it at 9. Although we do have that window of time to administer the medication, 8 o'clock, if that's the time it's ordered, we want to give it to as close to 8 o'clock as we can. But of course, things happen throughout the day that may make this difficult for us. We also want to give the right route. So you want to check the route, confirm the patient can take or receive the medication orally or topically, or if it's a skin or eye drops. We want to make sure that the patient can take the medication as it's ordered, okay? And remember, unlicensed staff, there are certain routes of administration that you cannot assist the patient with, okay? And some of those are listed here in bold, and that would be vaginal, rectal medications, or anything going under the skin, intravascular, intramuscular, okay? Next, we want to document properly each dose offered to them on the medication observation record. And we want to document administration after giving the ordered medication. Why? Because sometimes I'm sure you have experienced in your practice, I know I have in mine, if you document before and you go into the patient's room and for whatever reason they don't want to take the medication, now you have to backtrack that documentation, okay? And that's not what we want to do. We want to document after things are done so we can get all information as accurately and as timely as we can. And even if they refuse, we want to document that information. We want to chart the time it was offered, the route, and any other information, whether they refused or not, and what our action was, okay? Next is the right response. We want to make sure that the drug led to the desired effect. If, for instance, if we gave an antacid for heartburn, was the heartburn relieved? If we gave medication for a headache, was the headache relieved? Did the patient say that their head hurt less? We want to make sure that whatever the objective, the medication was ordered and administered for, it was achieved. We want to make sure that that objective was accomplished, okay? And again, make sure you document your observation of the resident and their response to the medication and share that information with the healthcare provider. Number 8, we want to confirm the rationale for the reason why the medication was ordered. What does that mean, the rationale? Well, the rationale means the reason why. Why is the patient taking this medication? So we want to make sure that this is the right reason and this is the right medication. And this is something you can do by talking to the pharmacist, the doctor, the nurse, just clarifying with other members of the healthcare team, okay? And last but not least, the patient has the right to refuse. This is number 9 of our 9 rights for medication administration. The resident has the right to refuse a medication by Florida law, and that means any medication. We cannot compel or force them. We cannot put the medication in their food without them knowing, even if their refusal is detrimental to their health in any way. We cannot force them to take the medication, okay? And that is it for our 9 rights of medication administration. We're going to take a brief intermission here, and I will be back with you, and we will pick up with our best practices for medication safety. Okay.